Hi everyone, my name is Steve Lawson.
My name is Anya Fofana.
And we are here today at our global headquarters in Waukesha, Wisconsin on the SIGNA Artist MR scanner. So thank you very much for your time and attention to be with us to learn a bit more about the latest offerings with the software release that we're calling SIGNAWorks Air IQ Edition. And we're going to show you how that relates to cardiac imaging.
Perfect. Let's maybe go and show already the first important parts about the new Air Edition, and that is the air coils. So let's review which air coils are already available on the Artist scanner. So first of all, that is the Air AA coil, which has 30 elements in total. The really nice thing about that coil is the coverage.
Yes.
So you can see when we put it just maybe in front of Steve, and maybe we should do that again one more time in front of that camera here. So Steve is tall, as you can see, and even on him it would cover just in one setup. When you step by this, maybe to the side, everybody sees that it would cover really the liver and your pelvis without switching coils, without moving the coils, because the coverage is 65 centimeters, right? So this coil is designed as a blanket. That is why you can see we can move it around as you want. It's really lightweighted. You can put it like sideways, upside down. And the scanner doesn't have to know how the coil is positioned, right? Because we are using a second feature in the MRI scanning. That is what we call air touch. So coil selection is done automatically. So with this coil, you can whenever you have a use case where you don't know how to fit the coil onto the patient, that is really a nice coil to have, because somehow you can make it happen with that coil, right? Yes. Then we have those two other coils available already on Artist, and these coils we call multi-purpose. Multi-purpose because we think there's not only one way to use them, not only for MSK, you can also use them for small field of view scanning, and that is why we want to show them really today for that cardio session, right? So we have two sizes available. The one Steve has in his hand is the large size. Then we have here the medium size. The large size has 21 channels, where the medium size has 20 channels. And this one is really a nice coil to use for all the cardio sessions. As you can see, the footprint is nice and small. It's again easy to set up on your patient for a heart scan, and also this one can be rotated.
Yep.
The scanner knows how the coil is in that position on the patient and will select the coil accordingly, right?
Yep. And they work in conjunction with the posterior array, so wherever you have them on the table, the system knows where the posterior array, relationship to the anterior array, all coil configurations and everything are all automatically selected without any intervention from the technologist. Everything's all done automatically that way.
Yeah. And really what for me changed when having these air coils is that I know once a week it happens that somebody's walking through your door and doesn't fit in a coil, right? And then as a technologist, you maybe even at the end ending up using only the body coil. And we all know how the images will turn out. Yeah. But with these flexible coils, you know that I'm not worried who's walking through the door anymore. Yeah. We can just fit them somehow on the patient, even though if the patient can only lay weirdly on the table, but you have a solution, right?
Yeah, it gives you a lot of options for these.
Okay. Let's do the scanning session.
Sure.
Just please lay down here. Yeah. You do the next, okay? Just So here you can see when we go into the room that you have an easy way to access the ECG getting to visualize that at the in-room display. Steve just moved his mouse over his cardiac triggering, and then we see that the ECG leads are fitting perfectly. So we are secure that when we start scanning, everything is perfectly doing right? And then he's laying comfortably on the table with in feet first positioning, and then what we are using is the MP coil, which we just demoed prior for the scan session. So we are using that multi-purpose coil, which is 20 channel for the cardio imaging. We can just put it on the region where we know his heart will be. You see already, since it's like light-weighted, it will fit and suit his body anatomy perfectly. And just to secure him, we have some Velcro strips attached on the table. So it's easy again to just use those Velcro straps to make the coil fitting on his chest. And that's pretty much all you have to do, right? And now we know that the ECG leads are working perfectly, that the coil is not too heavy, is where his heart is, and it really shapes his body anatomy perfectly because it's so lightweight. So then I want to show you one more feature about the scanners. We don't have to do the typical landmarking anymore. You know that usually you would turn on a laser, you have to like stop an additional time to like center the heart. What we do have, and I switch again one more time here to an in-room display, is an IntelliTouch located on both sides of the table. And the feature, the thing you will do for landmarking on our scanners is you will just use your fingertip and push the IntelliTouch on the side of the table. So you see now when I push with my finger, the in-room display has changed automatically to the view where you see now a dotted line. And the dotted line really means that that is all we have to do for landmarking, so nothing more to do. So again, it's an easy setup. It really has less steps in order to get the patient into the board. So let's get started, right?
Sure.
Okay, so I push again one more time the button. Steve is getting the table inside. I will just hand our volunteer the squeeze ball.
Great.
Okay, go ahead.
All right, great. So we're here at the MR scanner. Usually you're going to have a his/risk system connected to the MR scanner. You could just select your patient from the list. For us, I've just typed in some information here. One really great workflow enhancement from the MR scanner is you're able to keep a protocol very close, commonly used protocols you could select from this list, and then it would pull that protocol from the library tree, and then you wouldn't have to go retrieve it. So that's a really great workflow enhancement. Then I just click the Start Exam. We're going to select the operating mode of first level, and that's it. So for here, very simple, we're just going to run a 3-plane localizer at first. Simply just click Scan.
And then maybe one thing we can talk about here is we talked already a lot about air, but one thing we want to really emphasize is the new feature Air Touch, which is our coil recognition technique. So when we enable again the localizer, you see in the lower right side of the user interface that you just enable an entire coil. So it's so easy for the technologists that they don't have to understand which part, for example, of the PA elements to turn on and to turn off. The software will do that for you. So Air Touch is working as the following, that we do before a localizer scan, create a sensitivity map. So the scanner turns on all the channels during this 2-second approach, and the coils in that field of view will give signal. So after that coil calibration sensitivity map, we know exactly how the coil is positioned on that patient and how it is angled. And the scanner does the rest. He has all the information shared and just turns on the element needed to provide really the best image quality. And even consider stuff like acceleration factors. Yep. So to really make sure that no matter how much you accelerate, it will always use as many coil elements needed to provide always best image quality.
Yeah, it gives you the best results that way. So we've got our 3-plane localizer, and one thing that we have that's really nice for our scanner is something that's called iDrive. So that allows you to do a real-time localizer, using like a fluoro-like technique. So sometimes you have congenital anomalies or, anatomies that are anomalous in some way, or even different body habitus that cause the rotation and translation of the heart to be in a different position. So this is great because it allows you to just get all your localizers from this user interface. We'll show you right now. I'm going to go ahead and save that and scan it. And then it'll take us to a different user interface.
that gives you that flexibility to be able to get all those, the translation and rotation out of the heart. And then you save those images, and then later on when you're scanning, you can just localize on those. So it's a very nice feature. So this is it. So we are real-time scanning now. So this is a nice feature, as I mentioned. So very simple to use. All I'm going to do is just, click one of these sagittal, axillary, coronal views. I'm going to use this draw line tool, and then I can, do an angulation here. It looks like that's the mitral valve plane through the apex of the heart. Maybe slightly rotate a little bit more. I'm going to click go. So that gave me a 4-chamber view.
And it's already almost perfect, right?
It's already pretty good. So from here, I can just click Save Image a bunch of times and get that. Maybe I want a little bit better of a left heart view to go directly through the mitral valve to the apex of the heart. So I can easily get that and then click Go. Once again, now I'm getting a perfect left view of the heart this way. And then I can just click Save Image a bunch here. All of those are being saved to the DICOM database, so we can graphically prescribe on those. I can get you, one slice maybe through the base of the heart. So that looks like a good basal view. And then, maybe I need something for the outflow tract. You can generate those as well, should you need those. But those are just really great ways to set those up.
Yeah. And I think you can even switch the phase and frequency on these images, right? So in case something is like different, because we know all the hearts are located different, and you can do that on the flight without starting all over again, right?
Yeah, absolutely. So if I were to see some wrap that came into the image, maybe your patient's a larger patient and you're doing that, let me just try to get a different view. Maybe we can see a little more wrap than we wanted. So in this example, if I didn't want to see that, or maybe I did see wrap, I can just quickly swap phase and frequency. This is the wrong direction though, because we see the shoulders coming into that. So very nice to be able to get that type of image. And then that's a good, mid ventricle view there. Let me go back, kind of repeat this just a little bit. So let's try that again. One thing that's great that I like to use, I know everybody's different, but I like using this Define Scout. And then from here, as I'm angling, it's automatically giving me that view there. So I can kind of tweak the angulation just a little bit and get exactly the view that I want. So for me, that's the best way to use this tool. And then I can click Define Scout here again. Now I wanted, like I said, I wanted a basilar view. I like that. I'm going to save that. Then I can move this down lower and I can get one of the mid ventricle. Got a little bit of wrap there. I'm going to turn that off. Click Save Image again. Then I'm going to go down to the apex of the heart. And then I'll get a couple of views there as well. And then just save those.
Awesome. And as you saw, it's running as long as you want it to run, right? So you can spend as long there. You don't have to rush through it.
Yeah.
And then whenever you are done, just close the session, and then we can continue with the true short axis and the true chamber views, right?
Yeah. So the high resolution Cine Fiesta images can be acquired now. So I'm going to go ahead and first thing I'll do is I'll just set a shim. So one great tool that we have on the system is to be able to set these shims. And what I've done is I've automatically set every sequence afterwards to copy that same shim location. So I don't have to even open that or check that. So,
and you save that in the protocol, right? So you never have to vary it. Just position it once and then it's done for it's applied to all the other following sequences, right?
Exactly. So yeah, that's a nice way to set that up. So looks like we're going to do maybe a short axis view, but first thing probably would be to pull in some of those localizers that we've acquired. So if I wanted to get, like a good 4-chamber view, I'll just use that one. That was one that we got from our real time, and I'll just graphically prescribe that, just to give you an idea of how that would work. Our gating is still going on here, so we've got some nice ECG traces there to be able to set that up. And I'll just set up a few slices here as a good example, I think. You can put in a pause here between those, so 15-second breath holds for those. So yeah.
And it's also maybe worth mentioning that the breath holds is done via the machine. It's also saved in the protocol.
Yeah.
Maybe we can click on that we can show how easy it also would be to switch languages. So think about your patient maybe speaking Spanish better than English. You can easily switch to a Spanish setting and even save a protocol with that as well. So don't have to fear about all these patients not like speaking your language anymore. You can easily switch.
Yeah, that's a great feature. Okay, so I've got that set up. Those are 15-second breath holds. We'll just do a few slices of that, and then we'll just go ahead and to scan those. So we were thinking also that we would run a Cine Fiesta as well, using a new feature called Recon DL. So
again, the word air, right? So Recon DL is really our latest feature, and that is, I think, where the most excitement is right now about, because it's a deep learning feature, right? So what does it do? It reconstructs images with a removed noise. So it's really a reconstruction-based tool. So we don't put filters on images or stuff like that. So we've trained a machine to understand which part of the K-space is noise and which part is a signal. And what do we want to have in the MR images? We mostly want to have only the signal and not the noise. Yep. So it removes the noise with a certain level, and we will show you in a second how it is set up in the user interface. And then we will construct without that noise, and then we will see images which are way better, having way less noise and have way sharper images here as well.
Yeah, exactly. So right here on the user interface, we have a selection where we would just select the level of Recon DL strength, of basically how much noise you want to remove. And most of our customers, what we're seeing, they're using high. So that would give you the ability to do some things that you couldn't have done before, scanning much higher resolution, much faster, or usually both. So you're able to get the benefits of, having really clear, sharp images without that issue of noise coming through on them. So, particularly in a lot of examples, particularly with cardiac imaging, you're doing some high resolution, blood suppressed techniques where you're doing double inversion recovery, triple inversion recovery, that, you're using a signal or a pulse to null signal. And often at times that signal can cause a little bit of noise in the images, or depending on your resolution, maybe a lot of noise. But it's a great thing to be able to reduce that and remove the noise from the images with this new artificial intelligence tool that we have. Okay, so let's run this particular scan. This will be a Recon DL with the Cine Fiesta.
Yeah, and as Steve mentioned, really we've seen people using Recon DL in different approaches. Since you don't have to, I'm in tech since 20 years, so I've learned since 20 years you always have to balance signal and noise. But that is something we don't have to now. We don't have to consider the noise anymore. So what I use now Recon DL for is now that be really fast in scan times, because I don't have to average signal out anymore. I don't have to accelerate multiple. I can accelerate really high, and I don't have to fear that the images have not enough signal, because I don't have to worry about the signal anymore, right? The other way, as Steve mentioned, is that people use Recon DL to have really high resolution images. Because again, when you have a high metric size, usually you would have to use more averages, less acceleration to have good signal to noise ratio. But with Recon DL, you can do best of both worlds and still have nice image quality. And that is why I think everybody is so excited to use that, right?
I think so, yeah. It's really great. All right, so let's set up maybe maybe a 4-chamber double inversion recovery with fat suppression.
Also with Recon DL again, because that is really what we just said, is sequences who have the tendency to have already less signal, because we null out so much signal of fat and blood and stuff like that, they are tendency really noisy images. But since we again using Recon DL, we don't have to worry about that at all, and we have good image quality and really reasonable scan times.
Exactly. And then this one, we'll just set it to the Recon DL strength of high, as we mentioned. The reconstruction will just happen automatically for us. The great thing about the way we've got our scanner set up is you have the option, if you wanted to see the conventional reconstruction compared to Recon DL, you would get that option to be able to see both of those. So we'll show you what that would look like.
Yeah, a lot of people use that feature just like at the beginning of being new to Recon DL to make sure that nothing will get overwritten because it's still like a deep learning technique. But also here we can we have the feedback of customers that they maybe do that for a certain amount of time, and then they just like are so happy with the results Recon DL gives that they only look at the Recon DL images, right?
Yeah, exactly. Okay, so let's look at some of these images here that we've got. Just go ahead and load these in. So this is our cardiac gated acquisition.
Really high resolution.
Very high resolution images with Cine Fiestas. I think you can see really great results there with that. Really nice.
See the nice signal, even with the small coil setup, you have like signal everywhere you need to have it. So it's really the nice, almost a cardiac coil, right?
Yeah.
But the nice thing, it's still a multi-purpose coil. So if you have to scan a small field of view MSK, it's also nice to use that as well.
So we acquired this one with a free breathing technique with Recon DL. So we'll give you an idea of what that would look like. We didn't use any gating with this, so let's show you what Recon DL can give you in regards to that.
Yeah, that's the difference. And it's the same sequence, right? And it's not a filter we've applied. Maybe we should mention that one more time. It's just reconstructed with less noise.
Exactly. So you can see noise in the myocardium all the way around, and then the algorithm just simply removes that in the reconstruction pipeline where you can identify the noise patterns and then just remove that from the overall image, which gives you much better results. Okay. So Recon DL is compatible, in these sequences, as we mentioned, with in the heart, particularly where you're doing perfusion perfusion scans, you're doing late gadolinium enhancements or MDE scans. So this is a great way to use those to be able to get much cleaner, much sharper, noise-free images.
Yeah. Also here in the MBE sequence, we can apply it, right?
Mm-hmm. Yep, exactly. So I can do that.
I think this one would be later easier to show really on examples which we scan outside of the house, because here unfortunately we cannot scan any people, or our coworker doesn't want to have contrast media.
Yeah.
So we can look at clinical cases afterwards, but it's nice that we can apply Recon DL to Fiesta sequences, as you saw. We can apply it to the black blood inversion recovery techniques, and then also, and especially for the MDE sequences, right?
Exactly. So let's go ahead and pull up some of those on the double inversion recovery. So I'll use the Recon DL here on the right, and then also the non-corrected images there on the left. You can see the noise reduction and the sharpness, and overall just much better. Okay, so in addition to doing the short or the long axis double inversion recovery, we also did a short axis double inversion recovery using the basically the same scan, just copy pasted it and changed the orientation. Very simple, easy to do. And then we'll look at those images in the viewer here so we can get an idea of what Recon DL does for us on these. So let's go ahead and launch that in our tool. And from here you'll be able to see the really great example of how Recon DL can dramatically clean up noisy images. Image on the right is without DL, image on the left is with our Recon DL. You can see, you know, there's some noise breakthrough on the original conventional reconstructed images, but then the Recon DL just really does a fantastic job in improving the overall image quality here and sharpness as well.
Yeah, that's really exciting. And as we said today, we've used settings always too high, which is the most noise removement. So for some people who are new to Recon DL, the images were a little bit too clean. So you still have the options if you want to have something in between those two to then use and switch your setting and save it in the protocol as well. So again, nothing for you to physically change while scanning. You save that in the protocol, the Recon DL strength, and then the scanner does it all for you.
Exactly. Or you can even further optimize your protocols. You know, these are still quite good. You know, that's a great image, I think. But maybe if you're, having such a tool that reduces noise in the image, then you can even do even more. So maybe we just show a quick example of that, where instead of doing maybe 8 millimeters thick, we could do, say, 6 millimeters thick. Inherently, we're going to lose a significant amount of signal just from reducing the slice thickness. We'll just show you kind of an example of this.
Yeah, that's really the beauty, that now you have the tool where you can switch easily to neither being incredible fast or being incredible high resolution, and you don't have to do all the rethinking you had before Recon DL, right?
Yeah. It gives you a lot of flexibility in your protocol parameter selections where, if you see a lot of noise, before you had to be careful and kind of balance parameters. Now it's quite easy to just simply get great images, despite your resolution maybe being way higher than what, you used to be able to do. So it gives you great results that way. Okay, so let's go ahead and view these, what we have now. So we'll compare the two images without DL. So you'll see the image on the left is a bit noisier than the one on the right. Yeah. That's expected. These are conventional reconstructed images, 6 millimeters on the left and 8 on the right. So, but we can actually view the
Recon DL images.
Recon DL images here. So images on the right now, DL, images on the left without.
Maybe we don't have to say which one is which, right? I think it's pretty clear.
Yes. So overall, just fantastic.
Awesome.
Great.
Let's start with an image review, I would say.
Sure. Let's look at some clinical cases. Okay, so just a few clinical examples. As we mentioned, we can't give contrast here in our facility, but just a few examples of some new features in SIGNAWorks Air IQ edition. So we have a new motion correction algorithm that can be ran for the cardiac perfusion. So the image on the left is without motion correction. And you can see that the heart, is jumping around a little bit. So with patient respirations, these scans are about a minute, maybe a little bit longer. So inevitably the patients will breathe a little bit, causing a little bit of that. But sometimes there's some residual motion from some cardiac movements. So this will help do a little bit of correction here for this, keeping the heart basically in the same position, giving you the ability when you were to maybe use some post-processing software to keep the heart in that position could be a huge benefit. But then on top of that, we mentioned Recon DL. This is the same data here. So this is without Recon DL on the left. And then you have with Recon DL. And you can see the image sharpness improvement here. It's really great to remove a lot of the background noise that's in the in the tissue surrounding the heart, but then also within the myocardium as well. Can lead to a lot better results with these. So you can see that it's it's much better for these types of exams for that. So, all right, let's show you another example of that with another exam using Recon DL. Okay, and then here is another example of a clinical case. So just the regular Fiestas here in the upper left. Great results there with that. Here's a left side left two-chamber view. But these images here are the Recon DL on the late gadolinium enhancements or the myocardial delayed enhancements. The top is with Recon DL and the bottom is the conventional reconstruction. So we can go through these slices and you'll be able to see, how noisy the images are with conventional reconstructions, just simply due to the resolution improvements that this particular customer was wanting. But you can see the area, within the myocardium is, it's much better with the DL because of the noise reduction there. And then this is a four-chamber view here. Same data, non-DL, and then DL here with that. So, yeah.
Perfect.
Yeah, it's really great results with that so far. Additionally, there's a lot more inside of our SIGNAWorks Air IQ edition for quantitative mapping. So if you want T1 mapping, T2 mapping directly from the GE protocol library, you're able to select which type of T1 mapping, T2 mapping, T2 star mapping directly from here. And those are just as easily set up just as we've scanned some of those today. Here are a few examples scanned on the SIGNA Premier. So these offerings are available across the entire portfolio. These images here are the myocardial delayed enhancement, MDE or LGA images, and with Recon DL on a patient that has myocarditis from COVID-19. And once again, you can get the T2 mapping, whatever type of quantitative imaging you would need directly from those types of scans. So.
Okay, perfect. So everything is applicable the same way on 3T as on 1.5, correct?
Absolutely. Yeah, exactly the same way. So if you're interested, we have a lot more information on our packages and our offerings inside of SIGNAWorks Air IQ edition. We have some live scanning sessions that you'll be able to view directly from our YouTube channel. There are some webinars that are available. And then we have some SIGNA Pulse articles as well, directly available from our website. We'll put some links up here on the page for you to be able to access those. And then, there's also a lot of great peer-reviewed research literature that you could also review too. So,
thanks for your time today and your interest.
yeah, thank you very much.
Bye-bye.
Bye.